Okay, thank you. Good afternoon. Thank you so much for coming for this event. We are so glad to having you here after the discussions having on biodiversity and health as this plenary. So we are going to start just making a quick context of this event. Minal, can you please help me with the, okay. So for those in Zoom, so we have some house rule. If you are not speaking, so please mute yourself. If you have any question, you have the Q&A box. You can also leave your comments in the chat. And this session will last mostly like 1.5 hours, maybe more, maybe less. And we have translations in Spanish and French. For those here, for those here in person, you can also join translation, joining the Zoom event. No, so you put on the globe on interpretation, and we have in Spanish and French. So thank you so much. And Tina, we can go with you.
Oh, that was great.
Yeah.
Thank you so much for joining us. So today, the side event that we wanted to have was on health, biodiversity, and gender, and is very much aligned to the agenda item which was discussed today. So what we really wanted to do at the Substack was that just kind of going back into some of the decisions or discussions in the CBD with health, One Health links. So at the CBD at the 15th session, under decision 1529, took note of the resolution 76300, which is the human rights to a clean, healthy, and sustainable environment, which was adopted by the UN General Assembly, and the resolution 56 of biodiversity health at the UNEA, which is the United Nations Environment Assembly of the UNEP. Through that, the resolution from the UNEA 5/8 had also decided that to converge subject to the availability resources, an ad hoc open working group, the open-ended working group, to prepare proposals for the science policy panel to begin its work in 2022 with the ambition of completing it by the end of 2024. Sorry, there are a lot of decision numbers. But I think if you're the CBD, I can throw them to you and you can say, aha, I know what that is. It's another decision. So pursuant to decision 14.4, paragraph 13B and C, this is relevant to the agenda item that was discussed this morning, on targeted messaging in a draft global action plan and target message, an updated version of the draft global action plan on biodiversity and health was shared this early January 2024 for inputs. So I'm going to leave it all the acronyms right here. So what we really wanted to do was that looking at these links, we're always talking about synergies, cooperations. So we really wanted to build in the links with what is happening in the other spaces. Like if you know that you have a UNEA process, you have the CBD, you also have the recently established global framework on chemical and its waste, which happened last September in Bonn. They also talk about chemical waste and health. So we just wanted to bring key speakers to this event on the CBD and also hear from some of those lovely colleagues who work on these different spaces, and to also help us build these linkages within our work. And one key element I want to talk about is, while we are talking about biodiversity and health, the zoonotic disease, which is kind of pretty much in this document, we really want to also get the social aspect of what are the links or the gaps when we're talking about biodiversity and health, but while it was also for gender, but also overall, like in a social, cultural aspect of these links. So I will not take further ado. We have amazing panel today, and we really wanted to make it more of an interactive discussion, so no presentations. And I will not keep waiting. We have one of our key person from, we have a message from the CBD Secretariat colleague who follows the One Health within the Secretariat. And to say, is Sharika online?
Sharika, yes, she's online. Sharika, if you can turn on your camera.
Perfect.
All right, thank you. I'm online.
So thank you so much, Sharika. Sharika is joining this event from Jamaica. So she's like in the other side of the world now. And first of all, we want to start with the objective of the event. Minal, if you can. Minal, if you can, yeah, okay. So, no. Okay, thank you. So have a little bit of context, no? So to address the triple planetary crisis, we need to involve climate, biodiversity, chemicals, and pollution. No, so we are trying here on this panel to address all these items, and it's going to be a little hard because we have a little time to do so. But it's also to the One Health approach. We need to address it with the crucial and recognizing of the importance of preserving ecosystem and habitats. And also have to promote sustainable practices of the activities on the environment. So we can address it effectively. And first, before starting with the discussions, I want to share a message from Marianela Quesada from the Convention on Biological Diversity. Unfortunately, she couldn't join us today because she was still working on the results of the plenary session. So just a little bit, Marianela, she is a biotechnology engineer. She has worked from the UNEP and now she is the program officer for invasive alien species on biodiversity and health. No, so she has been currently supporting the discussions that we had today, and we asked her 3 questions that she's going to be addressed in the videos. So, Minal, thank you.
And thank you very much to the organizers for extending an invitation to the CBD Secretariat for being part of the side event. So I've been requested to comment on 3 things today. I'm going to start with some reflections on how the rights-based approach it's being integrated into the Global Action Plan, and it will ensure benefits of a health environment for all, particularly for women and vulnerable communities. So I will say that the Global Action
Well, yes, these technical issues are often something that comes up in the last minute. So while we are trying to solve this, because when we were running the videos, it heard loudly. Or maybe Minal, if now it
plan actually recognizes that health and biodiversity laws contributes to fulfilling human rights, including the right to health and to a clean, healthy, and sustainable environment. And thank you very much to the organizers for extending an invitation to the CBD Secretariat for being part of the side event. So I've been requested to comment on 3 things today. I'm going to start with some reflections on how the rights-based approach it's being integrated into the Global Action Plan and how it will ensure benefits of a health environment for all, particularly for women and vulnerable communities. So I will say that the Global Action Plan actually recognizes that health and biodiversity laws contributes to fulfilling human rights, including the right to health and to a clean, healthy, and sustainable environment. And that this goes in line with resolutions from the United Nations General Assembly, but also with the Kunming-Montreal Global Biodiversity. The plan also notes that environmental degradation and biodiversity loss actually contribute to health inequities, especially for vulnerable groups, including women, children, and the elderly. And it notes the adverse effects that environmental degradation can actually have on indigenous people and their unique relationship with local systems, including their physical, mental, and spiritual health, as well as their healing practices and systems. I will then add that the plan, in line with the Montreal Global Biodiversity Framework, also propose a whole of government and whole of society approach. And therefore, the participation of all actors of society will ensure that their unique perspectives and relationship with the elements that are part of the nexus between biodiversity and health are actually considered. So, for instance, the plan promotes the meaningful and active participation of all actors, recognizes their unique contributions and the differentiated roles that some of them might have in the mainstreaming of biodiversity and health linkages. So, for example, the special role that women play, for example, in public health, right? And finally, the plan also recognizes the importance of gender responsiveness and intergenerational equity, and it calls for those two important aspects to be taken into account on the actions for mainstreaming biodiversity and health inequities. To reflect or elaborate on the specific measures that are envisaged in the action plan to address plastic pollution and the impact that it has on biodiversity and human health, but especially on the impact that it has on women. So I will say that the plan actually recognizes that pollution in all its forms is harmful to the biodiversity, the health of the system, and the health of people. And it actually notes that pollution has an impact on the ability of biodiversity to contribute to services such as, for example, helping us with clean air, water, pollination, pest regulation, soil fertility, and many others. So I would say that overall, the plan actually recognizes that nature contributions to people can be negatively impacted by pollution. And with that in mind, the plan proposed a set of actions to mainstream biodiversity and health interlinkages in the context of pollution. And it does that also considering Target 7 of the Montreal Global Biodiversity Framework, which calls to reduce pollution to levels that are not harmful to biodiversity, including but not limited to, for example, working towards eliminating plastic pollution. So even if the plan itself is not a plan on pollution, right, it does provide entry points and suggest actions that countries can follow to facilitate the consideration of biodiversity and health linkages when they are addressing pollution. And the plan, for instance, suggests the importance of raising awareness of these negative impacts from pollution, including, of course, plastic-related pollution, which actually, if added to the multi-sectoral approach that is promoted also by the plan in line with the One Health approach, and with the inclusive whole of government and whole of society approach, which is also captured in the plan in line with the GVF, it actually then should provide opportunities for various actors to really get involved in these aspects. So through these participatory mechanisms, then, which will be implemented in accordance to national circumstances and priorities, the different actors will actually have an opportunity and a role to play in how they can make these actions on pollution presented on the plan, inclusive of the considerations and perspectives from all members of society, and of course, including women. On how the CBD how can the CBD work with governments and stakeholders to ensure the effective implementation of the action plan, particularly at the local level, where women and vulnerable groups are most impacted by biodiversity loss and environmental degradation. So in this respect, once the Conference of the Parties has made a decision on the plan, and this will happen later in the year, then the CBD will support parties on its implementation following any guidance that might be given to the Secretariat by the COP. So the plan will be actually implemented at a national level in consideration of national circumstances and priorities. However, it should be noted that it can also be used by other actors and stakeholders, such as, for example, also multilateral environmental agreements, and it can be used by other projects and initiatives that are also working on mainstreaming biodiversity and health linkages. And their support and implementation of the plan can actually be beneficial in adding and supporting the efforts that are being done at a national level. So in this respect, I think that the CBD Secretariat could play an important role in facilitating the process of dissemination and also understanding and uptake of the action plan by these other actors as well. So as I mentioned, the mandate for a CBD engagement in the implementation of the plan is going to come from the COP, but it could include, for example, supporting activities at a national level, regional or global level to facilitate the understanding of the plan. And in this respect, I think that activities that could promote sharing of lessons and experiences under different contexts could be particularly useful to support the broader use of the plan by other stakeholders.
Thank you.
And thank you very much too.
Thank you, Mina. Well, that is Marianela addressing the points that we gave her to. And after this, I want to start with the dialogue. Now we have here our wonderful panelists. Maybe we can also spotlight Sherika, that has joined us from yes, from Jamaica. Yeah, and while we're looking for Sherika in the Zoom, here we have Cristina Romanelli from the World Health Organization. She's the focal point on biodiversity, climate change, and health. And Alan Rodriguez, I'm sorry, Alan Valdez. He's the co-coordinator of Latin American and the Caribbean chapter. And also Marianne Rife, she's the director of Women for Biodiversity. And Sherika, maybe you can help us if you turn on your camera. Okay, so we can go on. So Cristina, first I wanted to ask you, yes, from a WHO perspective, from a WHO perspective, yes, how has the definition and operationalization of the One Health approach been broadened in practice, and what blind spots are being opening up?
Thank you so much for that question, Ale. And I think it's a very valid and pertinent question at this present time. As we've seen from Marianela, she was talking about the Global Biodiversity Framework and how it really calls for a whole of government, a whole of society approach in line with the One Health approach. For the WHO, the One Health approach is not something new. It's something that we've been working on for decades. However, there are new elements in how we are operationalizing the One Health approach. And part of that began, let me take you back a couple of years ago. Part of that began when we, somewhere around the time where we had a big pandemic you may have heard of, called COVID-19. And it was clear when we were reevaluating how we do things and what measures we do to prevent and respond to disease, prepare and respond to disease. We started to look at what our blind spots are. And one of the major blind spots there was actually looking at what we call the environmental determinants of health. So those environmental determinants of health are indeed biodiversity loss, climate change, and pollution. So those environmental dimensions weren't fully embedded in the operationalization of the One Health approach. So one of the things that we had done was there was a tripartite collaboration between WHO, the FAO, the World Organization for Animal Health, and that was expanded to include the UN Environment Program, so that it would be a more complete collaboration to address each and every one of the dimensions, but more importantly still, to really start thinking about how to address these issues at source, how to prevent epidemics and pandemics at source. And so broadening that really enabled for that to happen. And then while that was happening, there was the establishment of a One Health high-level expert panel, and that to advise and to guide the actions of WHO and partner agencies around One Health. And that, what we call the OLEV, this high-level expert panel, came up with a new definition of One Health. And why is that important? That's important because for the first time ever, we have a common definition across the various UN agencies, which were typically looking at One Health through their own lens. And it really got to the core of those environmental determinants of health. You know, those preconditions that are necessary to ensure health and well-being. So that's a brief snapshot on how that has been evolving over the past 2 years. Fast forward a little bit, and 2 years ago, we launched what is called the Quadripartite Joint Plan of Action on One Health, which for the very first time also has this whole component on environment. It has an entire pillar addressing environment. And at the COP28 Climate COP in December last year, we launched a guide to support the implementation of the One Health Plan of Action. So all of these things flow and are tied together. Now, you asked me about WHO, and within WHO, all of these changes, of course, had a strong influence. But above and beyond that, it was great to see that there was a step change, even from health ministries attending our World Health Assemblies, which are the equivalent of the COP, but for health. And so there's 2 resolutions that I'd really like to draw your attention to. One of them is a resolution on Indigenous peoples, on the health of Indigenous peoples. And another is a resolution on pollution and chemicals and waste. So how do these link together? Well, they don't. They're separate resolutions, but there are points of synergy and complementarity there. So within the resolution on pollution, chemicals and waste, for the very first time, not only are we expanding things to think about those environmental determinants, but for the very first time, we're saying parties or countries, member states, were asking for a One Health approach to be applied in addressing issues of chemicals, pollution, and waste, which is a huge development, because if you look at how One Health had been operationalized in the past, it really was very much focused on that human-animal interface. It was very much about emerging infectious diseases and vector-borne diseases. There was some antimicrobial resistance, but it didn't really look at the issue of pollution. So we're seeing an expansion of that, and certainly a willingness to say, look, One Health does, if it's really about a whole of government and whole of society approach, can't look at each element or each of the different crises that we're facing in these distinct silos. We have to be addressing them in tandem. So that was exciting. It was exciting to see that there was a resolution that would called for One Health outside of the traditional areas of work. And as I was saying, concurrently, and I know this one is not directly related to the other resolution, nor directly to One Health, but it is such a timely development because the resolution on the health of Indigenous people called for the very first time for a global plan of action on the health of Indigenous peoples. Now, why is that important? Because we can't possibly disassociate the health of Indigenous peoples, who are amongst the most vulnerable segments of society and who are most impacted by environmental determinants, by biodiversity loss, climate, and pollution. When we're looking at these holistic and integrated approaches to health. So I think that is a very interesting, but also very timely progression, and see many synergies with what is happening here. Because even here in 2018, I know we had a pandemic in between. In 2018, we did have, well, the international community did adopt a biodiversity inclusive One Health framework at its COP14, which basically went under the radar, which is unfortunate and ended up being superseded by what was a pandemic. But within that, there was quite a bit of attention already to those vulnerable populations and how they need to be incorporated in the operationalization of the One Health approach. And from there, we then have the various decisions from COP15 onward. And now with the Global Biodiversity Framework, we have a real opportunity to bring these things together across sectors, including through the Global Plan of Action on Biodiversity and Health, of course.
Thank you so much, Christina, for telling like a brief resume with all this, like the improvement of the One Health approach. Yeah. Yes, you just like gave us the whole new perspective of it was, don't worry. But I want to like take the thing I just said. Oh, and Sherika is back with us. That's so great, Sherika. Thank you so much. I want to take what you said about the most vulnerable groups that are affected by this crisis, but then pointing the question to Alan. I want to say, how can we, so how can we engage the young people in also advocating for and implementing the One Health initiatives, no? As we know that the youth are also recognized as the most of the vulnerable groups in the society.
Okay, so it's still like a conversation that we have to do as young people, because we saw at the beginning that health is like a broader, just not only like to have like a cough or something like that. No, it's broader than that. And after the pandemics, many of the young people have a really difficult time, not only because as all of us were living the situation of the pandemic, but also to think about what is happening next about this, right? Like, because it wasn't not only we are experiencing our first pandemic, because others had others before, not at the same level of now, but that raised many questions about how young people or how we are living and how we are feeling this experience of living a pandemic, and why these questions start to arise: that how pandemic starts, what is a disease, how is that a disease can bring into this state to the whole world. So for one instance is to have this like hard conversation regarding the crisis that we are living that brought this pandemic. The other one is to how as young people we are going to start to think in our own health as a whole, not only as something that we are taking when we are sick, because it's something that we should maintain and see broader than just as individual. Is also to see as a level of the family, but also in the space that we are living, because it's not only to that seeing that I'm sick, but then I'm coughing to all the people is also to see that, oh, okay, so maybe if I saw something that is happening in the garden or something that is happening in the city, for example, once happened in Mexico a time that the bears were dying, like a lot of them were dying because there were like a high pollution at that moment, and people were saying why the bears were dying. So it was until that moment when people start to see that others were dying for a disease and for pollution in this case, is that they were thinking what is happening and what we can do. And this is something that same as young people we thought during the pandemics, what should we be doing to address this kind of processes that are not in our hands, because we are just living the to be sick or the sickness and having many things. So we start to correlate the sick with the main drivers, not only like the drivers that are associated with the sick, to be sick, but or to the diseases, but also like why at this moment the world is living this process of a pandemic. I will put this like, because this is I have been discussing this for a long time with many people, that young people that had a really bad moment for that. And these discussions brought, like, for one instance is what we live it during the pandemic, but also after, because we know that it's not only that to live as sick, but also to what are living after someone gets sick, but also the consequences to be sick or other get sick. So there are many situations that we should be living, but also to be in this part of the life when we are like changing a lot of things, like starting to identify our identities, identify or the what we want to do with our lives, but also what we want to study, but also the change of work. So many things are happening in our life at this moment of the human life. So the discussions are not only focused on what we can do to be healthy, it's also to think on how everyone can be healthy, because if everyone can be healthy, and this is something that in the ecology of diseases is called it, like when a population is healthy, it's kind of complicated or difficult that someone gets sick. So it's the same for us. If we are and making this reflection on what we need as, or what we can do as young people for the moment, is to see how we can address the crisis with the tools that we have, but also to think and reflect that what else is on our hands. We know that also is this part of not all have the same possibilities to address in the better way a disease. There are some young people that need to do caring with their family, or they are living alone, and so they are going through the sickness alone. But the idea is to have these conversations on not only how I'm going to go through the sickness, but also how can we prevent. And in the prevention is something that is now in the way that we are living now, is how also we can prevent in this manner to speak about the mental health, how we can prevent mental health, because we are living with many issues, but also how we prevent to be sick, and how we can prevent that our family or community gets sick. So for now, I think it's to address as young people, I could say that is to think on prevention rather than just to think on how to have a medicine, particularly to help us with any of the disease that we are facing.
Thank you so much, Alan, to give your perspective on the youth. And before losing Sherika again, I want to ask her about, you say in the Global Action Plan, they say like we can be supported in implementation, but a range of tools and a body of knowledge on biodiversity and health interlinkages. So Sherika, my question for you is, if you can tell us about the global framework in chemicals and their interlinkages with the convention and with biodiversity. So please.
Yes. So when we think about the One Health approach and we think about women and children, and we look at chemicals and pollution, the One Health approach, it speaks specifically to partnership. It looks at all the stakeholders, both private and public sector. That would be a part of the process to ensure that we get the outcome for the targets that we're discussing. In terms of women and children, we know that women, they are described as the nexus for agriculture health. They are also responsible for the consumption pattern within the household. And women also, they have what we would call, they're the custodian of special type of knowledge. How can we empower women through education, through involving them in policy discussion, through protecting their health and their well-being within the working environment, and how that will filter down in protecting our children and in expansion, the society. So we're looking at how do you integrate civil society discussions like the one that we're doing now as a part of national discussions with government, as a part of the industry discussions, as a part of media discussions, and where does those interlinkages go? The issue of climate change is one that has really been discussed a long time, but how do we all understand it and the impact it has on agriculture? How are women able to provide food for their family? How are women protected from the chemicals that they're exposed to, both through the farming community, through the different industries in which they work? And how does this impact their role in the home and also their role as a career person? So I will use myself as a woman as an example in all of this discussion. I am a married woman with a family. I work in the area of poison prevention, that is chemical. I also consume food, and I provide food for my family in terms of I am the one that prepare the food that will nurture my household, my husband and my child. And at times I have to work with chemicals even in the house. Now, what is in place to protect me as a woman handling chemical, not on the perspective that I have the knowledge of public health and toxicology? So if I work in the farming environment, what approach can be placed within that industry? What standards that can be placed within policies on the national level? What occupational health and safety acts and policies that industries can implement to protect me? Or it is that stand up for my rights? How do I know the rights that I have as a woman when I'm working within chemical industry? And how does this industry protect my health? In regards to the scarcity of food, if I'm a woman that work in a poor and low middle income community where I do not have a particular educational background where I can provide, say, for example, what you would call the daily nutritional value to my home, what is there within the agricultural industry to protect the food that I'm able to provide for my family and for my children? How do we look on how pesticides are used within our environment? How does that deplete what is already been there? How does this contribute or take away from the yield that has been produced? And what are the diseases that are being associated with women in particular in terms of gender when they are being exposed to these chemicals? What can we put in place? We can have standards in place. We can have programs that are implemented that monitor the use of chemicals within the farming community, within specific industries. We can have policies that speak to healthcare for women and how each industry plays their part actually in financing this process, because finance is a big part of the conversation. Who will be responsible, or which entities would be responsible for pumping funding into these different biodiversity sectors that affect myself as a woman, other women who are being impacted by this. And I speak specifically to women from poor communities because they're the one that do not have the type of knowledge that we expect them to have. They're the one that require the type of training that will give them that empowerment, that will give them the authority to speak about their health, the authority to stand for themselves, and the authority to speak about health and well-being. And how do we integrate all of that in the target that we want to see a feasible outcome for the chemical and pollution discussion within that framework?
Thank you so much, Sherika, for sharing your experience with us. Well, Sherika is the Poison Information Coordinator from the Caribbean Poison Information Network, CARPIN. No, we didn't have the chance to first introduce her. So before the technical things land, yeah. I also wanted to know about your experience in building bridges between the biodiversity and chemicals communities. Now, so how can we use such a multi-stakeholder partnership or initiatives to help build these bridges and maximize our impact on gender issues by connecting the silos? If you can share with us, can we bridge these gaps?
Yes, we can. And presently, I'm a part of the MSP Institute discussion on gender and chemical partnership. And one of the good thing about the powerful work that MSP and their stakeholders are doing is that what is happening in this lovely experience that I'm a part of is there's a formulation of a plan on how different stakeholders can share their knowledge, share their experiences, and have a roadmap towards looking at intervention for these problems that we have in society. How do we bridge the gap? Let us look on different sectors. We're going to look on the educational sector, the health sector, the media, the industry, and civil society. Bridging the gap means that government, through the education sector and through health, through agriculture and other policy regime, have discussion with civil society to understand their needs and also to formulate program with them on how they can have doable and workable interventions within society. Industry can play their role in contributing to the financing of these activities within country and partner with government in also providing training for persons who work within the industry and for those that lack knowledge of the same. How do we include the media in it? Now, when you look on even social marketing for some of the chemicals that are being used out there, the messages that media puts out there to ordinary society, what does it show to them? What is the meaning and the perceptions that people have from it? Some persons do not understand the harm that chemicals can have on their body. If we can have that partnership where there can be clear and transparent information through media guided by policies within country to explain to persons the lethality of some of these chemicals and how they should guard themselves against using some of these chemicals, we can bridge that gap in the media, training programs within schools, and we could start from the early childhood level straight up until the tertiary level. How do we build curriculums within the education system so that we can educate the now generation into the future generation on the impact that chemical and pollution is having on biodiversity and health. And this is one of the work that is being discussed and has been worked on in terms of research and other discussion that is coming out of my experience with the MSP Institute and the gender and chemical discussion. And these are some simple ways in which we can bridge gaps and build on them.
Thank you. Thank you so much, Erika, for your experience on these bridging gaps. So now I want to ask for our participants. So we have heard about the neopluralization and the blind spots that have been covered in the One Health approach. We heard about the youth perspective and how they can be involved in implementation of One Health, and also about the chemical frameworks and how we can bridge gaps through a multi-stakeholder platform. So I want to ask participants if they have a question regarding this, that want to share a reflection, so we can start like a more open discussion with our panelists here. Yes, please.
Okay. Thank you for giving me the floor.
Oh, sorry. I know you, but do give your introduction to everybody. And if there is a specific question or it's general, introduce yourself.
Okay. Thank you so much for giving me the floor. I am called Maimuna Omaru. I am an indigenous woman from Cameroon. I represent the network of indigenous and local population for the sustainable management of forest ecosystem in Central Africa, which is called REPALIAC. In REPALIAC is a network that is working in 10 countries in Central Africa, especially on biodiversity, land governance, and the participation of indigenous people in the global discussions. So for the past 2 years, we have been engaged in trying to operationalize or implement the concept of One Health. After some regional sensitization meetings, some of the organizations of the network were able to mobilize some small resources to start implementing the concept of One Health in the community, of which one of my organization is already implementing in one of the protected areas in Cameroon, Douala Edea National Park. But the key challenges we have been facing is we lack institutional support from our government. We lack the tools. We go to internet at times to download images, and which can permit us to sensitize the indigenous people and the local communities who are the victims of these zoonotic diseases. So I would like to find out from colleagues, or if they have any other experience that they can share with us on what are the existing tools for the implementation of One Health approach, especially to the World Health Organization. And if there are existing tools, how can us, the indigenous communities, access these tools? And how can we be communicating the result of what we are doing at the local level to the global level? Thank you so much.
Christina, you can open your mic if you want to answer directly.
Thank you so much for sharing that experience. You know, it's experiences like these that really, 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 really inspire me and give me hope for the future. As I was mentioning, for WHO, it is new to work in a much more dedicated fashion with Indigenous peoples. And it really heartens me to hear this phenomenal case study. We are seeing some changes in some of the finance mechanisms that are being developed and implemented. And there's one that's actually called Nature for Health. I don't know if you've heard of it, but Nature for Health was established as a fund to address specifically biodiversity loss and climate change in a One Health perspective. So it's very closely aligned with the aims and objectives of the Kunming-Montreal Global Biodiversity Framework, also very closely aligned with the Global Plan of Action on Biodiversity and Health. And what that does actually, and one of the core elements of that is ensuring that there is a local component and local engagement so that these initiatives are really spearheaded and led by communities at the local level together with government and different ministries. So I would I'd love to talk more about that initiative if it's something that could be of interest. And there's also vast networks of One Health that can help to catalyze those messages and share some of those best practices. There's even university networks that you can reach out to, such as Afrohoon, which is very active in different parts of Africa, and that is a tool to share best practices. And at the more immediate level, please share your experiences with us directly, because as we move toward thinking about, well, how do we really operationalize a global plan of action on the health of Indigenous peoples that is spearheaded by and co-designed with Indigenous peoples, we have to be talking about these experiences that you have and the challenges that you face to see how we can help and in what areas we can help to overcome some of those challenges. So thank you enormously for sharing that. And please do stay in touch.
Thank you, Christina, for your answer. Now, Sherika also wants to respond to that. But before giving you the word, Sherika, I want to remind our panelists, maybe we can have a brief 2 minutes, 1 minute answer, so we can have more questions from the participants. No, don't worry, Christina. So, Sherika, you can please.
Yes, Christina shared some very important and informative information. I just want to endorse what she said, but also to add to our colleague that shared the case study, that try as best as possible when you are planning these programs to try to get your local authority involved in it at the initial stage, because numerous times there are programs within countries that they're in sync with what it is that you're doing. And so it can just be an expanded partnership on what the government is working on. Sometimes getting them to buy into what it is that you're doing can strengthen your program. And oftentimes you can get resources that you can share within the community, apart from just using the internet. So I'd just like to encourage you to do that some more. All right?
Just to add, it would be nice to you involve local authorities, also involve youth in the process of creation, because sometimes the material that is in these spaces are not, they don't have the context of the place that you are. So many of the times, young people have this ability to use that resources that are like so general to bring it to the context, to the community, and they can give you another way to share and to have new, I will say, content for your community. So we are the innovators of many of the spaces. So it's also really good to have young people not only in the process of creation, but also in the planning process.
Thank you so much. Has anyone from the participants have a question? Also from our online participants, you can also raise your hand and ask the questions for the panelists. So, okay, maybe not now. So yes, with this implementation, I also want to ask for our panelists, what could be the most appropriate participatory mechanisms that can be implemented at local and national level to have or to ensure the participation of all stakeholders in decision making and access to justice and information related to biodiversity and health? It's a little big, but I don't know. have to like, Christina, you have to open your mic so in the Zoom can hear us.
I would say like, I mean, because when we are saying when we are talking about the rights of access, particularly to information that is related with the information that is given by the government or for the industries, so it's something that we should be pushing for in like together with other stakeholders. Regarding participation, it depends of the space because this is on will be, for example, at the community level, that if we are like being part of the process and taking some decisions for the wellness of the community, it's a way that we can address this at local level, right? Like we can take decisions for the wellness and live in the better way and healthy in our community, being part of the process. At national level, we should have these spaces for decision-making processes, but it's kind of complicated in some spaces. So in this regard, is just to open as much as possible the opportunity to young people to speak, but also to be part of not only in the decision-making processes, but also the planning for all the health issues.
I think those are all excellent points. And in fact, I think we need to create the conditions for young people to participate more, for women to participate more. And in part, now with social media, that becomes a lot easier in some ways. You see a lot more mobilization. You see messages that began in some small way having a large scale impact. So I would say absolutely, let's start from the ground up and let's start with youth, because if anyone can teach us how to use these tools, it is youth. But we also, from the other side, I mean, I already work at the global level, so it's hard to see all the various layers there. But I'm also saying, like, from local to global, we are all responsible for ensuring that those mechanisms are created so that those voices can be heard, and they can be heard at par. And that's part of what I liked of the Nature for Health example, is that it was not about what position or function one occupies within a given government. It was about saying, okay, who are the stakeholders, the right holders that need to be around the table to address the common challenges that we face? And so ensuring that those dialogues are tailored to any cultural differences that there may be, and to the different formats in which people are comfortable, I think are important. So I think that question is very important. And I think it's up to all of us to ensure that it actually happens. Youth, you're in charge.
Thank you so much, both Alan and Christina, for your reflections. Sherika, if you want to say something regarding that question, or
yes, just to add shortly that there are three ways in which oftentimes governments can engage persons in information within local community. One, there is something called public comment. So sometimes for policies that are shared within country, it is sent out for persons to do public comment on it. If that does happen within your locality, look out for these type of documents and please comment on them. It is important that you share your voice this way. Then you also have what are called town hall meetings. Sometimes town hall meetings are called. Whenever there's a town hall meeting that is available, try to make yourself available so that your voice can be heard in this meeting. And oftentimes you can have small focus group discussions where different pockets of society are invited to participate in focus group to share their perspective. So once these channels are available to you, utilize them, to get your voice out there as a part of public policy discussion?
Thank you, Sherika. Okay, so before closing, we have one more question related to the subset, but it's going to be after sharing the video of one of our partners, is the Multi-Stakeholder Processes for Sustainable Development. So he has supported us on organizing this event. Tina, you want to say something?
Sharika, you're familiar with this video. I think like we're talking about how some of the graphics really encourage us to have a really strong picture. So seeing what we are here for, and though we are having these discussions, what are the key asks we want from this particular discussion out here, basically the document, right? Before we do that, there's a beautiful video by MSP. Our partner is an event. So we'll give you a bit more of clarity is why we think this agenda was really very important to take in. So Sumina, if you already have that, if you can play that, that'd be fantastic. Thank you. Sharika, hope you can stay online.
Chemicals are everywhere. About 350,000 different chemicals are on the market globally, and production volumes will double by 2030. Every day, everywhere, people of all genders are in touch with chemicals. Gender stereotypes and gender roles have impacts on production processes, occupational safety, and consumer behavior. Despite all that, gender is hardly ever considered in chemicals management, and it remains gender blind. However, the gender lens helps you to see more clearly. For example, it can help us understand why people often disregard protective measures when they deal with toxic chemicals. Women are less likely to be able to afford well-fitting personal protective equipment than their male colleagues. They often earn less, plus protection for women is often more expensive or not available at all because it is mostly designed for the Western male body. Men, on the other hand, often believe that wearing protective clothing is unnecessary and indicates a level of weakness. Also, toxicology and medicine are often gender blind, which can have strong effects on people's health. That is why applying a gender lens helps everyone. Especially women, trans and intersex people experience phases in lives when their bodies become more susceptible to health damages from chemicals, like pregnancy or menopause. However, chemical risk assessments often don't include specific effects on women's and LGBTI's health. There is also little research on sperm health and infertility. The topic still seems to be taboo in our societies. However, sperm counts and quality have dramatically declined, and one reason may be chemical pollution. The gender lens offers new perspectives. It helps you to explore and understand problems in chemicals management and points to new paths for developing safe and effective policies and products for all. Therefore, look through the gender lens, put gender on the agenda, and invest in gender activities, because gender justice is the right chemistry.
Thank you. It was so interesting, the video. Now that we also like touch the chemicals again, Tina, I want to ask you the synergies between the global framework on chemical and the biodiversity plan. Like short, brief question, the answer.
Yes, as you know, I can talk all about it. No, I think this is a start of a partnership because, like I said, that we talk about biodiversity, we talk about biodiversity health, but there is so much happening at different platforms. There are different decisions being taken. So what we really wanted to bring in this biodiversity, because we do work with biodiversity, we are biodiversity people, is to bring in partners and experts like Sharika and expand that knowledge, saying that they are the knowledge holders. Give us this technical expertise, and there is work around gender and chemicals. And also looking at that, the global framework on chemicals, which I also attended, and Sharika was there, was also the same thing, that it's so much linked up with, we are talking about biodiversity and health, but we also understanding that this is also very linked up with Target 7, which is on pollution waste, chemical waste and pollution. But we really have not even touched upon that. And we have this huge, big framework where member states are there, civil society is there, and we are part of that, the gender and chemicals working group. So so we really need to bring these work together. So we work in collaboration. So I'm just going to stop at that because this can go on and on. But just saying that we really need to make those connections closer and bring that together. And also understanding that there is a lot of gender links, as you saw. And I know this question will come again, but I just want to end here, so I won't take the floor again. One interesting thing, I know the question, I really wanted to build it up here is we talk about social and cultural aspects of Indigenous peoples. However, what's really also important is to bring in the sexual and reproductive health. As you saw in the video, because I just want to say this is, we really haven't discussed this in the biodiversity. We talk about, if you talk, looking at the document, we talk about well-being in the presence of physical and mental and social, but this really needs to be taken apart, like what you talked about, saw in the video. And when we talk about sexual and reproductive health, we are not saying it's only women specific, right? When you talk about sexual reproductive health, it's seen as it's a women issue. And as you saw, it's not. And I think it's really important for the gender dimension because yes, youth are very important, but I always tell this generation is important. Yes. If you don't take care of rights right now for this generation, you may not have youth or it'll be less in number, at least in 5 generations. So that is what I want to see from this document, a few insertions, but the floor is yours. I'm done.
Thanks, Tina. That's a really wonderful intervention and give me the key for answer our panelists our last question. That is, now we are in the SBSTTA26, and what needs to be in the document on biodiversity and health, and which is one of the agenda items. So what is need to be done? Like Tina already mentioned, the sexual and reproductive health. What are your insights that needs?
In the document
of the
biodiversity and health. I know we only have 10 seconds and I need about an hour and a half. So honestly, though, I think it's important that we move this forward. I think that we have been waiting for a very long time. It's been 10 years in the making. However, it can still be strengthened. I think it can be strengthened in terms of how its assessment and consideration for Indigenous people's health. There is no real connection with Indigenous people's health in that document that can and should be strengthened. I think both in the Global Plan of Action on Biodiversity and Health and in the monitoring framework for the Kunming-Montreal that's the one for the GBF. That's what acronyms are for. I also think that we need to strengthen the components around traditional medicines and the discussions around chemicals, because there's not a tremendous amount of attention being paid to chemicals and pollution in that particular document. So basically what I'm saying is ensuring that we're addressing each of the different elements of the triple planetary crisis. That's definitely over a minute. Sorry.
It's okay, Christina, because your inputs are right on point.
Okay, so I'm going for two of the main that we have been advocating as young people. One is the intergenerational equity, to give it for sure in the growth of the document. The other one will be about transformative education. So you do not see that is education about health or education about environment, because it's more than that. It's how we interlink all the decisions that we're making, all the decisions that others are making, but also how we can the decisions that we are taking can help or not for the biodiversity into the process of the biodiversity loss, but also to help us to prevent diseases. And other one that is kind of important that for the experience that I had is traditional knowledge. I mean, one is for the for treats, but also for prevention. Traditional knowledge help it a lot to understand the cycle of a disease. So in the ecological part, so it's really important also to bring it into these conversations.
Oh, wonderful. And how traditional knowledge also links to traditional medicine systems. So I think that greater complementarity, we are completely aligned. Let's make it happen.
And Sharika, I don't know if you would like to.
Oh my gosh, Christina and our young person, they have nailed it so much. I'll just endorse everything that they've said. I think the importance of strengthening access to information for all stakeholders must be reinforced in it. And Tina's point about reproductive health, it can be some sort of a taboo conversation within the male arena in regards to pesticide exposure, but it is something that is very serious because we do have a lot of our men complaining about sexual issues who oftentimes use chemicals. And so this is, I'm so happy she highlighted it. And this is something that should be strengthened and reinforced in the framework in regards to gender and chemical. Because we're looking at the women reproductive organs, but also the male reproductive organ. And this is important. But they have nailed it. They have indeed nailed it.
Thank you so much.
So have you.
Thank you so much for all the people that stayed till the end of this event regarding all the discussions that are happening now. So if we can just if you can just join us here in the back so we can take a picture now for all the participants. Yeah, there with Sharika. So Sharika, stay there because we're going to take a picture with you. Yeah. Let's try. Yeah, we can try it. Thank you.